Everyone is talking about integration right now, and we think that's a great thing.
But as CADS and YMMs, young peer supporters working with children and adolescents living with HIV, we thought we'd share what integration really means to us and to the young people we support every day.
Because for us, integration isn't just a word for policies, guidelines, and budgets. It's at the heart of how we help young people to survive and to thrive. If you're a young person growing up with HIV, life isn't defined by just one thing. Yes, you need treatment, but you might also be dealing with stigma, mental health challenges, grief and loss, and other health conditions like TB. But then, like all other young people, you may also be worried about relationships, challenges at home or school, disability, and concerns for your future. Health is never just about medicine. That's why at Zvandiri, we've always said young people need more than medicines. If children and adolescents living with HIV are going to thrive, their care needs to reflect their whole lives.
That's where integration comes in and what we as young peer providers do. As CADS and young mentor mothers, we are young people living with HIV with the lived experience, skills, and tools needed to support the health and well-being of other children and adolescents living with HIV.
We are trained counselors, integrated within government healthcare teams in clinics and communities as a highly valued cadre within the national health response, not just for HIV, but also for mental health, TB, sexual and reproductive health, disability, and child protection. Our role is integrated in national policies and guidelines, national, provincial, and district level systems, and even in domestic budgets. For us, integration means looking at the whole person, not just a diagnosis. As CADS and YMMs, we work closely with each child or adolescent to understand their needs, medical, psychological, and social. Each month, we create individualized case management plans which ensure they get the information, counseling, and support or referrals they need, whether it's for their HIV treatment, mental health support, sexual and reproductive health services, other health conditions, or social protection. Not as separate processes or systems, but as one coordinated response around the young person. For example, I support 50 young people living with HIV from 0 to 24 years old. Each one has very different needs.
Elizabeth is 6 years old. She has been unwell and needed HIV testing. I counseled her mother, supported her to access HIV testing, and ensured Elizabeth initiated treatment after her positive result. Tafadzwa is 8 years old. She is doing well on treatment, but was being severely neglected at home. I referred her to social protection, and we are now working together to ensure Tafadzwa gets the care and support she needs.
Paul is 10 years old. He has just been informed of his HIV diagnosis. I counsel and support him to understand his HIV status and the importance of taking his medicines. James is 14 years old. His viral load is very high. I screened him for common mental disorders and found he is very depressed. I referred him to the mental health nurse, and I now provide enhanced counseling and follow-up to support his mental health and adherence to treatment.
Chipo is 16 years old. She hasn't been well. I screened her for TB and referred her for further assessment. I now support her to adhere to her TB medication. Alice is 18 years old. She's a young mom. She wants to prevent transmission of HIV to her baby, but she's facing so many challenges at home, including gender-based violence. I have counseled and supported, but also referred her to a place of safety and skills training program. We support our peers in health facilities, support groups, in communities, and through digital platforms.
Our services are integrated across these different platforms, ensuring seamless support where it's convenient and acceptable for young people at their point of need. The frequency of support depends on individual needs of each young person and may change from one month to the next. I support about 50 young people. Each one has different needs, different challenges, different dreams. But through person-centered integrated care, they're all getting the support they need. Yes, they all have suppressed viral loads, but their other physical needs are also being addressed. And beyond their physical health, they are happy, confident, resilient, with purpose and hope for their future. They're not just surviving, they're thriving. Integration works. When trained peer supporters are integrated into health systems, young people receive the holistic care they need to thrive. We also know when governments invest in CADs and YMNs, it is cost effective. So, if we are serious about improving outcomes for children and adolescents living with HIV through sustainable approaches, it's time to invest in integrated peer-led models. Because when young people support other young people, the impact is life-changing.